Hey guys, Jake here. Going to talk to you guys about a little bit about squat mobility and what tends to limit squat depth for most individuals in the gym. To start this conversation out today, we're going to talk about range of motion. Now, most coaches, when they see somebody who's going to be limited in their depth or their mobility when they're squatting, they're going to generally attribute it to some sort of restriction in range of motion, right? Some sort of joint, some sort of muscle, things of that matter. So, for my clinical practice and for my time coaching as well, there are three things that tend to be the most rate limiting in terms of squat depth when it comes to range of motion. First is going to be our ankle dorsiflexion. Our ankle dorsiflexion is our ability to bend our ankle in this direction, and it's sometimes represented as the knee going over the toe. Historically, there's been a conversation about knees going over toes, when should you stop a squat for particular knee angles to keep it safe. And they used to always say 90 degrees and things of that matter, and you shouldn't go past the toes. A lot of the literature we have now actually kind of goes the opposite direction, saying it's actually safer to squat a little bit deeper than 90 degrees, and that reversing the squat at 90 degrees actually has the most patellofemoral compressive forces, meaning it can be hard on the knees. So ankle dorsiflexion can really tend to influence your squat depth, depending on what kind of squat style you do. If you're a front squatter or some sort of pulley lifter, it tends to be more of a variable than it is for most power lifters. Next thing is our tibial internal rotation. Tibial internal rotation is our ability for our tibia, which is our shin bone right here, to rotate inward relative to our femur, right? So femur's fixed, tibia just rotated internally. Now, that's going to be a little less intuitive of a range of motion that can tend to be limited to people, because most people don't think about the tibia internal rotation for the mobility. But when I squat, ideally my feet are fixed in one spot. As I squat down, what's happening is my femur is rotating externally as I go down. And if that's on a fixed tibia, so the tibia relative to the femur then is rotating internally. What you'll see in that, and how that will be expressed if somebody is limited in that in a squat, is you're going to see one of two things generally. One, as they push their knees out, you'll see the big toe knuckles come off the ground. Two, and this is probably a little bit more common, is as I squat down, my knees are going to come in, I'm going to put more weight on my big toe knuckle to externally rotate that tibia relative to the femur. Third is going to be our combined hip abduction, flexion, and external rotation. Hip flexion is coming up, abduction is coming out, external rotation is going to be driving out like that. Okay? A lot of us are familiar with associating that position with the squat. A lot of muscles associated with potentially limiting that range of motion. And to go through them individually would be kind of cumbersome. You probably need a physical therapist to take a look at that. But overall, assessing the position and seeing if you're limited in it can be very rewarding in itself, and you wouldn't have to need to dive into all the individual muscles. Next, these two can manifest themselves very similarly. They're both associated with more of the neurological component of squatting. One is going to be balance, two is going to be psychology. I kind of wrote them backwards here, but I'm going to go over psychology first. This one's going to be the most intuitive for people. The psychology is going to be if somebody comes into the gym and they have a connotation of squatting as being dangerous. Historically, there's been a conversation in society about how it's bad for your back, bad for your knees, things of that matter. A lot of our literature now demonstrates the opposite, that it's very healthy for those things. But you got to take into account that the person coming in may not know that information and they may be apprehensive of the squat. Or they may have a history of some sort of injury that they associated with the squat and have that in their background as well. Balance is going to be our ability to manage our center of mass over our base of support. Okay? Most of us in our daily living, especially if you have like a desk job or something like that, spend our time in two positions. One being just standing, walking around. Two, I'm seated, but when I'm seated, I'm supported, right? And so my body's not having to manage my center of mass relative to my base of support, or my base of support is the chair versus my feet. And even though my base of support is more posterior relative to my feet. But what happens is, when I'm squatting, my base of support is the area that is covered by my feet and in between. And as I squat, my center of mass is now shifting backwards or posteriorly. And if you don't have a history of doing so, what's going to happen is it's going to feel like a skill that you just haven't managed yet, or it's going to feel very apprehensive and scary for the nervous system, and it's going to be very protective because it's going to be a fear of falling kind of concept. And both the psychology component and the balance component will represent themselves very similarly and manifest themselves very similarly in the gym if you're watching an athlete squat. It's going to manifest itself as somebody who maybe they're not bending at the hip, right? Or they do one of these kinds of squats and they're not shooting their hips backwards because they're afraid that they're going to be bending in their back. It may be the person who squats with an overly arched back, right? And again, potentially trying to, in their own mind, limit their load on their back. So those individuals may not be that they need some sort of range of motion help. It may be that they need to work on their balance. It may be that they need to address the subconscious connotation associated with squatting and the fear and things of that manner. So, for my practice and for my coaching experience, those are the three main factors that tend to limit somebody's squat mobility. If you want to assess it or look at more videos on how to improve that, please feel free to go over to the squat mobility playlist. And if you have any questions, please feel free to ping me. Have a wonderful day.